LS99 lifted.
They fly in some of the UK's most dramatic landscapes.
Okay, the weather's starting to close in. I'm worried I can't get over the ridge. My escape option at the moment is to go up.
From high-rise city centres...
It's going to be bumpy, it's going to be turbulent, guys.
...to remote peaks battered by extreme weather.
The top looks to be in cloud. Can you confirm that's the case, over?
The crews of Yorkshire's 2 air ambulances risk their lives...
Gone unresponsive.
It's just gone unresponsive on us.
...to save yours.
There's potentially fatalities involved.
That car's a right mess.
Delivering intensive care by air.
It's not safe.
There's a lot of blood there. There's a lot of blood there.
No matter how critical the case.
This is the first time anything like this has ever happened.
We're circling a house fire.
However risky the place.
I'm going to get down there quickly.
He's got an almost complete amputation at the right knee. You're having a heart attack, okay? The heart is blocked. Let's get loaded and go.
Going to extraordinary lengths.
Hey, this from Medic 2 at the patient's side, however.
With humour.
You might get rest at week off if you're lucky.
What is it, Thursday?
Yeah.
And compassion.
OK, chick, we're just going to get you out, all right? Don't worry, we'll look after you, I promise.
This time on Helicopter ER.
He's had 2 shocks. Previous MI. That's not good.
The team fight to save the life of a man who collapsed during a fitness class.
His BP's not great. I don't really want to flatten him. He'll have no blood pressure left at all.
A man is seriously injured when a 60-foot beech tree falls on him.
I heard a big creak.
A big creak, did you? Not surprised.
A creaking.
Yeah.
And a pensioner trying to do it himself has a lethal fall.
At the very least, he needs a CT scan of his head.
I always tell him to put his trainers on.
OK, what's the address of the emergency?
Every day, over 3,000 emergency calls are made to Yorkshire's Ambulance Nerve Centre.
Ambulance service, is the patient breathing?
And ordinary people are told how to give life-saving CPR over the phone.
I'll count the pulses for 15 seconds. I'll time you. Just let me know when you found a pulse.
At the Nostell Airbase, paramedic Mikey is listening in to one of these calls.
If you look inside the defence, there'll be information as to where the cab should go.
Might have a job here. Sounds like somebody's collapsed at Doncaster.
Okay, I know it's really scary, okay, so just keep going with the compressions, okay?
Let's go.
Bystanders are trying to resuscitate a collapsed man, but he needs medical attention fast. Mikey is on the case with paramedic Pete and Dr. Jez.
Engines both to flight.
Confirm both flying date.
Confirm, doors harness stretcher.
Close secure.
Clear left.
OK, lift in.
We're going to the Keepmoat Stadium in Doncaster, which is the big football stadium there. There's an exercise class going on, and a male in his 60s has collapsed and he's in cardiac arrest. Someone's got an AED, which is an automated defibrillator, and just as we were leaving, they were putting that on him.
Only 1 in 10 people survive a cardiac arrest outside hospital, and their patient has a history.
He's had 2 shocks. Previous MI. That's not good. No. Well, at least he's in a shockable rhythm, isn't he? So there's a reasonable chance we'll get him back.
Hello, 98 Alpha's landing. I'll call you on this.
The medics are remaining calm, but this is a life or death situation, and within 6 minutes of takeoff, pilot Elaine has Helimed 98 over the scene.
Visual stadium?
Yeah, visual.
Oh, that grass looks good.
Nice grassy bit.
Start descent.
Head S98 on approach to sea. Yeah, there's looks like a bit of panic. So you're well clear of the trees and lights left.
Cheers, mate.
Tail is clear.
98 landing.
Thanks, guys.
Frantic efforts by bystanders to revive the patient have restored a pulse. Now local paramedics in full COVID protection have taken over his care.
So he's got a ROSC, I'm assuming. Has he got a ROSC? Has he got a ROSC? Yeah, ROSC, sorry.
68-year-old Brian is in a critical condition. He was warming up at a fitness class when he collapsed.
Do we know much about his past medical history? Is this a cardiac rehab class?
Got a big scar down his front.
Is he a regular gym member, or is this kind of a cardiac rehab class? It's just a regular gym member?
Yeah.
Okay, bro, thank you. He's got a good volume radial, mate, isn't he? He's got a good chest. I've not had a listen to his chest, but he's got a good chest expansion. The question is whether we just need to intubate him, isn't it? He's pretty flat.
Yeah. The GCS is still 3, isn't it?
So we'll get him onto a trolley. If his GCS is the same, we'll give him an anaesthetic and tube him.
Brian's heart stopped pumping 20 minutes ago, depriving his brain of vital oxygen. It's beating again, but it's weak.
Blood sugar 9.5, did we get a temperature?
Only the efforts of gym staff have kept the retired taxi driver alive, using the club's electrical defibrillator, but he could arrest again at any moment.
Ready? Steady.
Well, he's already knocked out. We're just going to give him an anaesthetic just to secure his airway before we move.
Dr. Jez is going to put him into a medically induced coma, a procedure called an RSI. It is proven to save the lives of cardiac patients by reducing the strain on their hearts and brains.
Brian? Brian? Oh, he's got quite a lot of ectopics on there, hasn't he? A lot of ventricular ectopics.
Brian's readings are showing abnormal heart rhythms. He first had a heart attack in his 30s.
So I was going to use midazolam, fentanyl, rocuronium. He's got a reasonable blood pressure.
Yeah.
We'll put that monitor on the floor down here once Mikey's done this. Let's get a kit dump set up for an RSI. He might be having a vomit in a minute, so let's just watch. We'll just get some straps on him in case he pukes. So we need that on the floor. We need CO2, mate, please.
An RSI is usually only carried out in a sterile hospital operating theatre, but without it, Brian may die.
Okay, tube holder in position.
Thank you. Yep.
Yep. Suction unit in position, switched on. Yep.
Yep, it's ready.
Okay, ventilator. It's on oxygen.
He's on oxygen.
Yeah. Yeah, you've got your working laryngoscope, number 4 blade, that's been checked.
Yep.
Got the Gell's forceps, you've got a bougie.
Yep.
Got size 8 ET tube, which is cuff checked and lubricated.
Happy with that, mate? Got a sat trace. Excellent. Right. And what's the BP on there, Mikey?
127/85.
Thank you. Right. Will you just stop that fluid for me? Right, I'm going to give some drugs now. Will you time a minute, Pete? If you can give all of that, mate.
All of that?
Yep.
That's going in now.
Yeah, all of that, mate.
That's your minute, Jeff.
Dr. Jez is sedating Brian. The drugs will stop his lungs from working, and the team must quickly take over his breathing.
So he's a grade 1 view. Just have a tube, mate. Tube. It's gone in.
Dr. Jez is carefully guiding a breathing tube into Brian's lungs.
23 centimetres at the lips. We've got CO2. Lovely. Have a listen, Mikey. Thank you.
Noisy, but it's
yeah, he's got quite a lot of creps down there, so we'll put a suction catheter down.
Do you want vent now?
Yes, please, mate. Yeah.
They've done it. The team have successfully taken over Brian's breathing.
He's got a good end tidal CO2, so he must have a cardiac output.
Yeah.
Sats are 100. Have we got a BP going? I might just get a bit of metaraminol because his BP's just dropped a bit and his heart rate's gone up.
Jez is giving Brian a drug to increase his blood pressure. It's plummeting, and he's in danger of arresting again.
His BP's not great. I don't really want to flatten him. He'll have no blood pressure left at all. So we're ventilating. His chest is going up and down.
They're doing all they can.
Yeah, he's definitely ventilating.
Brian's readings are improving.
He's got a good end tidal CO2. I'm going to give him a smidgen of metaraminol, mate, and then we're good to go, I think.
He's stabilised, for now.
Happy to go, guys. So we'll just take it nice and steady, not to knock anything off.
The race is now on to get him to hospital.
He's had a collapse whilst doing exercise at the gym. I think he's had good bystander CPR and a few shots with an AED, which has got a pulse back. Crews have got here and we've got here, and he's been put to sleep. Jez has RSI'd him just so that can protect his breathing and his brain a little bit, and the plan is to take him through to Doncaster Hospital.
Jez and Mikey will accompany Brian to hospital in case he deteriorates on the way. Without the quick-thinking actions of strangers who performed immediate CPR, Brian's life would already be over. It's summer 2022, and in Yorkshire, a record heat wave has ended in thunderstorms. At Air Ambulance headquarters, the crew of Helimed 98 are being scrambled to South Yorkshire. a man has been crushed by a huge section of falling tree.
Okie dokie, 101, 2 good engines. We'll depart out that way into Windsor with a right-hand turn as soon as we've got some airspeed on.
As the skies begin to clear, pilot Harry is racing paramedics Terry Ann and Andy 15 miles to Rotherham.
Are you ready for a grid?
Yep, all ready.
Sierra Kilo 4398.
It's Clifton, Rotherham. You're attending a 59-year-old male reported to have a chest injury and difficulty breathing. There's a DCA just booked at scene. Received.
Brilliant, all received, thank you.
Dr. Paul is flying with the team today.
All we knew travelling to this job is that a big tree had fallen over. We were expecting the worst. We thought the patient could have some really significant injuries.
Within 6 minutes, the team are over a busy park.
Okay, so 12:30 school, DCA just parked to the right of the school. Park with the fairground in it. Ah, seen, yeah, just 1 o'clock now, just beyond the school. Yep. Okay, so I'm just going to do a quick orbit round just because of that fairground and make sure that the approach will be into that, into the park, but there's plenty of room for me to land. Oh, there's definitely a tree down.
We're just above me.
Thank you.
We're clear to the left.
Yeah, clear to the left.
Old lady with dog for 3 o'clock. Visual old lady, I think. Dog will hold her up if any. Levers fully down.
Telemed 98, landing.
Their patient is being treated by local paramedics beside a shattered 60-foot beech tree.
How then? How are you doing? You all right?
Not in a car or anything. He was stood on the pavement as the trees come down. Just head injury wise and some C-spine pain at the moment, which is where we're at.
All right.
Which we haven't moved anyway, just because she landed. So
yeah, no problem.
The tree fell on me.
As we get, just having a looks like a lightning. It looks burnt. The tree, you know, like a tree on the inside of the tree burnt. Looks like a bit like lightning.
All right, yeah. Is it your relative?
My husband.
Your husband, is it? Hello, sir.
Hi.
Hey, what's your name?
Pete.
Pete. My name's Andy.
59-year-old lorry driver Pete Jarman is in a lot of pain. He was with his wife and granddaughter when the tree split apart and fell on him.
Do you remember everything that's happened?
I was walking, I heard a big creak.
A big creak, did you? Not surprised.
Creaking.
Yeah.
And I sort of tried to run out the way, and the next thing crashed down on me.
Can I have a look at the wound on your head?
Pete's taken a massive blow to the top of his head.
You see you got some neck pain, yeah?
He's got degenerative spine anyway, so he's got some C-spine tendons, which he says worse than normal.
Not surprised, we bumped him down there, didn't it?
And we've got some pins and needles in the left leg as well.
Just gonna have a listen to your chest.
Okay.
Deep breaths from me. Alright, any chest pain when I'm doing that?
It hurts, but it's not bad.
Oh, okay.
A heavy weight such as this huge tree hitting him on the head could not only cause a significant head injury, but also it causes compression going down the spinal cord, so all the bones in the vertebrae that protect the spinal board can be crushed.
Pete and his wife had been in the park with their granddaughter and were walking back to their car when the accident happened.
Just keep your head still for me.
Sorry.
Any pains around there?
Yeah.
Whereabouts? On this right-hand side here?
Can I bob you a little needling, buddy, then we can give you a bit of pain relief, okay?
Just try and keep still if you can. Right, where is it? There?
Yeah, on my chest.
Do your hips feel okay?
Well, they're as good as they can be.
Yeah, they're not any different than normal.
Oh, yeah, pain there.
Pain there. I'm going to cut your jeans here, is that all right?
What?
I need to cut your jeans up here to have a look at this leg.
My knees? My jeans?
Your jeans, yeah.
These are my favourite ones.
I know, but...
I've had them for years.
Your life's more important than your jeans. I just want to have a look at this leg.
You crawled out from what I hear, did you, buddy? Yes, mate. Yeah, okay.
Can I just lift your leg there? Right, the bone feels stable in that leg, so it's got an abrasion there. Can you lift that leg up? Yeah. What about this leg?
Oh, that one hurts, but it hurts down the bottom.
Right, we'll have a look at that one as well, eh? When we get you matching, you can put these into shorts if you want.
Paramedic Andy is joking, but he knows Pete may have serious injuries and he needs to be checked over thoroughly.
Bit of painkiller going in now, buddy.
They're giving Pete morphine.
Essentially from top to toe, we've got the split on the head, we've got some some markage there, but he's got some generalised pain across the chest, abrasion wrist, left shin,
and right thigh. He's not sure if he has been knocked out or not. So I think pain relief, we'll get a bandage on that, immobilise him, because he's got some neck pain, and a trip to hospital.
It's remarkable that Pete is still conscious and talking.
So that's probably... That's that long. Like a Y, it's a Y-shaped.
Pete's wound is severe. The paramedics have stemmed the bleeding, but it looks like he may have a fractured skull.
One of the concerns was that that could have damaged the underlying bone, the skull itself, something that we call a depressed skull fracture. And if that bone had pushed in around the brain, that could cause some direct brain damage or damage to the brain itself.
Where's your worst pain at the moment?
Neck.
Right, scoop stretcher. We'll lay it on there, and then I think we'll do a standing.
Yeah.
Right, fella, I'm going to take your head, and with assistance from us guys, we're going to stand you, and we're going to sit you on our stretcher now. Ready, steady, stand.
Half a dozen people are killed by falling trees or branches every year in the UK.
Nice and steady. Right, might just want to go down just a little bit, guys. That'll do.
This gentleman's been unlucky in one respect to be standing underneath, and it looks like the tree's fallen directly onto his head and then his chest and his lower legs. He's got a head injury, he's got pain to both sides of his chest and quite a lot of abrasions and cuts and bruises to his arms and lower legs, but at the minute he's fully conscious and his observations are pretty good actually, so the plan is to get him on the ambulance at the moment and then we'll make a plan as to where he needs to go from here.
Just keep your hands in, fella.
Heart rate 75, so that's 97.
Are we happy with his obs?
Yeah, just the blood pressure's just running, mate. It might be a bit low to the morphine, but... Okay, fantastic. Yeah. Awesome.
Sorted, guys. Are you happy, yeah?
Yeah.
We'll get out your way. All right.
Thank you.
All right.
Thanks for everything.
All right, take it easy. See you later, mate.
Cheers, Andy.
Pete will travel to Rotherham Hospital by road, freeing up the helicopter for other emergencies.
Everything's normal, and when we've examined him, he's obviously got this big cut on his head, but that may well just need a clean and some stitches.
Yeah.
His lungs at the moment seem to be working absolutely fine, but when we get him back on the ambulance, we'll have another good look at him top to toe, just to make sure we're not overlooking anything.
It looks like a robust stone wall may have taken some of the tree's weight and made the difference between life and death for Pete today. He's heading straight for scans, when the full extent of his injuries will be revealed. It's a crisp winter day, and high above North Yorkshire, Helimed 99 is heading to the spa town of Harrogate, where a DIY job has gone badly wrong.
99 air desk.
Hello.
It's a 78-year-old
male who's fallen off the top of a ladder. He's hit his head, his arm, got significant chest pain, lots of pain.
And leg pain.
The race is on to get paramedics Mikey and Andy to the injured man, whose neighbour is on the line to the 999 operator.
Just keep his eyes open, all right? Try and keep talking to him and reassuring him, okay? We don't want him going to sleep.
Dr. Andy is flying with the paramedics today.
We've recently had some very bad storms in Yorkshire, and that's caused a lot of damage to people's properties. A lot of people, in the aftermath of those, they get themselves up on ladders, up onto roofs and stuff, trying to repair the damage.
More people have accidents in the home than anywhere else.
I do lots of DIY at home, but this job has taught me that it's a very dangerous hobby. Using saws, hammers, knives, going up ladders. You should try and protect yourself at all times.
There's a golf course right to the south of this. It looks like it might have a nice little track going straight into that street.
Looks good, yeah.
Hopefully we can land pretty close to this scene and do a trolley push.
Having said that...
A lot of trees in there.
Yeah.
We'll grab a butcher's.
Why don't we just go down here to the right and then you can walk up the track a little bit? That's probably safer. Okay, that's the plan. No wires, just the trees forward and down. It's just going to be bumpy.
You're clear of the trees left.
Roger. All clear on the right, forward and down now. Landing on.
Their patient is lying injured in his back garden.
Morning. Hiya. Now then, how are we doing?
He's in the care of local paramedics.
So I had a bit of a collapsing type deal.
Sounds like
while sort of up there.
Yeah, so we go for a collapse.
Come down and out of it.
Yeah.
77-year-old Terry Jones was climbing onto the roof to adjust his TV aerial after the storm when his ladder slipped sideways and he fell 12 feet onto paving stones below.
So shoulder, right
shoulder, left upper chest,
left chest,
and left hip.
How much of an assessment of the pelvis have we had? Just had a quick look.
Basics, haven't really got a full.
Okay.
So when I pressed anywhere near his left hip, he yelped.
Terry was unconscious for over 10 minutes. His worried wife, Maureen, found him.
Hello. Hi, my name's Andrew, one of the doctors. Just while they're doing their stuff, is he normally fit and well?
Yes.
Does he take any medicines at all?
Yes, he had a stroke two and a half years ago and had a complete recovery. Well, it was a mini stroke.
Good, good.
Take a breath. Terry's in a lot of pain and is fighting for breath. Mikey is checking for signs of internal injuries.
Terry, is it in here? Or higher or lower? Up there? All right, sorry. It's got reduced left.
Reduced
side,
left?
A little bit reduced, yeah. Not a lot. There is air going in, but not as much as the right. Okay.
All right, okay.
His rests aren't up. We need to move him, really.
Yeah. He's got a laceration to his head here, and he's on a medication called apixaban, which is an anticoagulant. It thins the blood, and the significance of that is it puts you at much higher risk of a bleed inside the head if you've had a head injury. So at the very least, he needs a CT scan of his head to make sure that hasn't happened. Other than that, we're just trying to get him some pain relief to make him comfortable, and then we can move him onto the scoop, get him onto the trolley.
You're just coming over to me, Terry.
The team are carefully rolling Terry onto a 2-part scoop stretcher.
Down, ready, steady, roll.
Yep, is that enough?
Yeah, that'll do. So, back down, ready, steady, roll.
Given the likely height of his fall, and that he has had a bang on his head and he's on a pixaban, we probably will take him to Leeds. But like I say, we'll have a look in a second, take it from there, okay?
Terry, hold your hand there for us. Right, are you two happy top end? On yours, Mikey.
Ready, steady, lift. Nice and steady, Terry, you're all right.
41,000 people are hospitalised every year in the UK after falling from ladders.
Well done.
Terry's choice of footwear today didn't help.
I always tell him to put his trainers on.
Where's your main pain?
Oh, my chest.
In your chest, okay. Just take a breath in. Take a breath. You're okay?
Yeah.
Just keep going if you can. Concentrate on trying to get your chest to go up and down.
Dr. Andy's concerned about Terry's breathing. He may have punctured a lung.
Take a big breath again for me, sir. Okay, both sides of the chest are moving equally at the moment, which is good. That's fine, yeah, cover him up, that's fine.
We'll get ramp up and doors shut.
In the warmth of the road ambulance, the team can examine Terry more fully.
Gonna keep you covered up. Is that a bit warmer for you, Terry?
He may have broken his pelvis, which can cause life-threatening internal bleeding.
It's deep in there. I think it's more hip. He's unable to flex his leg.
He's got a lot of pain in there. There's nothing to lose by binding him. Should we give him some TXA as well?
They must immobilise the fractured bones with a pelvic binder, but it's painful.
I'm just going to lift your hips up, I'm sorry. Just take a big breath. Here we go. 3, 2, 1.
I've attended lots of incidents with people falling off ladders. Ladders inside, short ladders, long ladders, and ladders outside. Nobody gets up in the morning and plans to have an accident. Just plan exactly what you're going to do, and if in doubt, get somebody to hold the ladders.
Terry could quickly deteriorate. 2 of the team will travel with him to the nearest major trauma centre by road in case he needs medical intervention on the way.
How's your breathing feeling? All right?
A bit sore,
Yeah.
Good to go, Andy.
Yeah.
Terry's condition is serious. It could be many weeks before he returns home. It's another glorious day in Yorkshire, and in the Dales the roads are busy with cyclists, but the county's challenging hill climbs and steep descents are not for the faint-hearted. At Air Ambulance HQ, dispatcher Andy is on the phone to a woman who has called 999 at the scene of a cycling accident.
So he's banged his head and shoulder. Does it look like he's bleeding? Yeah, right. And he's got a weak pulse.
All right, OK. He's come off his bike, pothole, head injury, shoulder injury, he had a helmet on, he looks pale, he feels a bit hypotensive.
Helimed 99 is readying for takeoff.
So whereabouts we're going to, mate?
We're going north west.
Ilkley Reservoir, just north of by Ilkley. Ilkley, OK, copy. I've sent you the routing, mate, to take us by Echo up so you know where we're going.
Pilot Owen is flying paramedics Gemma and Gav, and Dr. Steve 21 miles to a reservoir in the Washburn Valley.
Our dispatch has been listening in and heard a call come in. Someone's fallen off a push bike, and there's a medical professional on scene that says the patient's looking quite unwell, very pale, and his radial pulse, the pulse at his wrist, feels quite weak, which could be a sign of significant bleeding. In this instance, if the patient has got some internal hemorrhage, we can triage them to the right hospital. We can also deliver blood products if required. It won't stop the bleeding, but it'll give them a bit of a bridge to hospital where definitive care can be provided.
12 o'clock now, see the woods are. I think that's the left and right on the road.
Yeah.
OK, so I need a church left hand side of the last bend. So I'll go from the church and I'll follow that road down just in case the grid start the outs.
Is there a bike there? There's someone in the blue.
There might be behind this hedge.
Yeah, A for visual.
Yeah, he's on the floor.
Right,
Got him.
so the field with the sheep in looks like it's not the best access. Got to swing around. Right, so tail down slope then, see what it's like. Are we clear off? Just check the skids when you get up, please. Cheers, Gemma.
Hi guys.
Local paramedics are giving 62-year-old railways manager David Young gas and air for his pain. He was riding with a friend when he came off on a steep descent.
Coming down here basically relatively quick. I don't know if he hit a stone or a pothole.
Yeah.
His wheel bobbled. He went to the side, obviously spun off it. Went down hard on his shoulder.
How's he been since he landed? Was he conscious straight away?
Yeah, he was conscious straight away. He's very white. His pulse, the doctor who stopped said his pulse was very low.
Okay.
We tried to sit him up because he was in the road.
Yeah.
Well, not sit him up, but try and move him. He went really lightheaded and...
Okay.
David was cycling an 80-mile section of the Tour de Yorkshire and was doing around 20 miles an hour when he hit the pothole.
You remember everything that's happened, David?
I do, yes, yeah.
Yeah. Yeah, it's got a bounding radial there. That's good. Any pain in the back of your neck, David? Here, just keep it nice and still.
No, the neck's fine.
Your neck's fine?
It's
just the shoulder.
Just the shoulder, yeah.
No pain anywhere else?
No.
Nothing in your chest here?
No.
A big breath in for me? That's good, yep. Give a little look at your helmet, okay? Just lift that off.
That took a bit of a whack because I could hear it. So.
Yeah, it's taken a bit of a scuff there. It's not cracked it or anything, has it?
No, it's done its job. Yeah. That's the main thing.
He's been out cycling and he's hit a pothole, losing control of his bike and then coming down and landing hard on his shoulder. So he's complaining of a shoulder injury, which will be really, really painful. So we've arrived, administered some pain relief with the help of the ambulance crew, and we're just going to get him in the ambulance, assess him a little bit further, and then hopefully he can be transported to hospital in the ambulance.
Okay, I'm going to come under your good arm and we'll just sit you up and we'll just do a bit of time, all right? Sit yourself up and then we'll just take a breather.
We come to an awful lot of cyclists, and as a cyclist myself, it does put a little bit of kind of fear or kind of awareness of how close we are to risk when we're doing our sport, but we love it and it doesn't put me off.
Ready, 1, 2, 3, up. And then we'll just take a breather again.
Yeah, well done.
All right?
Super duper.
Sure, and we'll have a little walk in the back and get you sat down with your feet up.
Yeah, that's a bit better than
yeah. A bit better than the gutter, isn't it?
Yeah.
There you go.
David is stoic, but he was thrown over the handlebars and rolled several times down the hill.
There's an actual little hole in the road up there.
Yeah. I think that must be what I've hit because that's the way the wheel went.
Yeah.
Now that he's safely in the ambulance, Gav and Dr. Steve can assess the extent of David's injuries.
Yeah. So where I'm touching there, that's sore as well. It feels roughly in joint there. The contour is nice and smooth.
Been able to do that?
I think that might be a scapular injury. Yeah, it's probably AC separation, a scapular injury, I think.
David's collarbone shattered in the impact, In 30 years of cycling, it is only his second injury, but it's a painful one. He'll go to hospital by road.
See you later.
Yeah. Nose on the back of the ambulance, he's looking a lot more steady. He's pinked up a little bit. His heart rate's quite low, but that's normal for him. He's quite an active cyclist. It's down in the high 40s, low 50s. Obviously, really sore shoulder injury. His chest's absolutely fine. Abdomen's okay. There's no evidence of internal bleeding, so the crew are going to look after him, give him some pain relief and take him up to the hospital.
David's lucky he wasn't more seriously injured. But with what looks like a complex fracture, he faces a long and painful recovery.
So, Cliff, you've got a job.
On the air desk, dispatcher Kit is scrambling the team over at the Air Ambulance's North Yorkshire base.
You're off to Ilkley Bridge for a gentleman having a stroke. There's a crew on scene, but their ambulance is broken down.
Ambulance breakdowns are rare. At the Topcliffe Air Base, pilot Harry and paramedics Andy and Lee are racing to the rescue of their colleagues, high in scenic Nidderdale.
Edison 99 was lifted heading Ilkley Bridge.
Right, thanks.
We have been dispatched to Ilkley Bridge in the Yorkshire Dales for suspected stroke outside a GP's practice.
Sending a replacement land ambulance would take too long, and time is critical. Treatment within the first 90 minutes following a stroke is crucial to recovery.
A stroke is something that's caused a reduction in the blood flow to the brain. Falls in two categories, so it could be an embolus, like a little blood clot, or it could be more serious, which is hemorrhagics. Either way, if it is, and I've got signs of any type of stroke, need to go to a serious hospital for a CT scan of the head.
Pilot Harry will have the team by the patient's side in just 7 minutes.
Edison 99, is the patient, do you say they're on the back of the DCA? Over.
Yes, the DCA has broken down and they're stuck in the village. We think the patient's in the back of the ambulance at the moment. They're about to set off. Confirmed stroke, and they'll be going to Leeds.
Edison 99, overhead, Ilkley Bridge looking to run.
Ilkley Bridge is a traditional Dales market town and an hour's drive from the nearest major hospital.
Can't see a DCA yet. It's meant to be where that yellow van is in the middle of the town. That's the grid we've been given. Ah, there we go, visual, yeah. Just up the street from the yellow van. Okay, cool, right.
The only clear landing spot is in a park a quarter of a mile from their patient.
I want to put it down in the 1 o'clock, mate. That's my preferred one. It's just whether we can open the gates. No, they're not, are they? I'm happy with this. We'll just sit here.
Just sit here. You happy here, yeah?
Yeah.
Once we get to the main road here, we should see a yellow van, and it's just further up.
Andy and Lee must walk the short distance on foot.
Yellow van. So I can see good lights.
The faulty ambulance is parked outside a doctor's surgery. The patient has been taken back inside, where local paramedics have assessed him.
This is Peter, but he'll have to be called Nigel.
Okay, yeah.
So Nigel's 71 years young. Around 11 o'clock this morning, he started with some flashing and double vision in his eyes, and then started to feel unwell soon after. Around 13:20, he started with a right-sided facial droop, a numb jaw followed by slurred speech.
Okay.
Sue is very worried about her husband, retired firefighter Nigel Carrington. They came to the doctor's surgery when 71-year-old Nigel began seeing flashing lights. The GP called for an ambulance.
Blood pressure is 170/91, BM is 5.4, temper 36.7, resp 16, and GCS is 15. LGI was pre-alerted at 14:30, ready to accept him. Now, Nigel does have some mild dementia, it's just been diagnosed. So he has reduced memory, but it's normally not as bad as this.
The slurred speech, just loss of his arm, have you seen him like that before? You have seen him like that before? Right, okay.
The question is, does it leave any more damage than...
Well, yeah, that's the thing, yeah, and the only true way to sign will to scan his head again.
Yeah.
That's what he'll to do, yeah. But he'll do that LGI.
It is now more than 40 minutes since the first emergency call. If Nigel is having a stroke, his oxygen-starved brain tissue will be dying. the damage could be irreparable.
Pilot Medic 1, Harry, we're gonna fly sat up, mate, and we're gonna attempt to drive the DCA down to the field entrance of her. So this chap's complaining of altered vision, disturbances in the sensation in his hands, and a facial droop as well. So they're all signs and symptoms associated with a possible stroke. And with us being a little bit out in the sticks, as it were, I think the quickest way to get into hospital for his assessment that he needs is to fly him.
With Nigel already being carefully monitored, the job for the air ambulance is to get him to hospital fast.
It is a bit tight round here, isn't it?
The road ambulance has a technical fault. It is unfit for emergency use, but it is safe to drive the short distance to transport Nigel to the waiting helicopter.
Just going to put this blood pressure cuff back on. Yeah. All right. And, to let you know what's going on, then you're going to be in the helicopter going to Leeds.
999.
Have you been to the LGI before? Oh, were you?
Yeah,
right,
his partner in there, he's been on this before. Yeah, he's on the bridge.
Yeah, just if you head over the bridge, and then it should be the first field on left, first sort of gate.
I'll get a little bit bumpy, Nigel, okay. What we'll do is we'll take you off here, pop it to the aircraft, okay, pop you down to LGI. Get you there pretty quick, yeah.
Nigel's had strokes before, but this time there won't be room in the helicopter for Sue to accompany him. He'll have to make the journey to hospital alone.
Just loading the patient right now. He's going to sit up for us. So between 1:05 and 20 minutes over. What would be probably like a 35-40 minute journey is probably going to be a 10-minute flight for us to hospital. So in terms of time critical intervention, if it is a stroke, then he'll get hand scanned and he'll get the appropriate treatment.
Bloody hell, I'm shaking.
Yeah, it's a little bit the adrenaline with everything that's happening, okay, and probably a little bit the cold as well. There we go. This is just like a little sleeping bag up the top here that might just make you feel a bit more comfy, all right?
Edison 99 with lifted head in LGI.
Fantastic, thanks guys. LGI Helidecker away.
During the 21-mile flight, paramedic Lee keeps a close eye on Nigel.
How are you feeling?
Nervous.
Nervous? Are you nervous about the trip to hospital or nervous about the helicopter flight?
Both.
Both. It's alright, you're in safe hands. You're not being short of breath at all? And a cough?
A little bit.
Have you?
Yeah, a little bit.
When did the shaking start?
I don't know.
You don't know?
The team are landing at the Leeds General Infirmary, just inside the crucial treatment window for stroke victims.
Ready, finished. Wonderful. And we'll bring the back of this stretcher up to meet you, okay?
Right.
Nigel is heading for scans to his brain and clinical tests. If he is having a stroke, it could change his life. But there's some good news for one of the team's earlier patients.
His BP's not great. I don't really want to flatten him. He'll have no blood pressure left at all.
68-year-old Brian was in a coma for 4 days after collapsing with a heart attack during a fitness class. It was his 4th heart attack in 30 years. The induced coma carried out by the air ambulance team undoubtedly saved his life. Surgeons at Sheffield's Northern General Hospital fitted Brian with a new pacemaker. He is now recovering slowly.
I heard a big creak.
Scans in hospital revealed Pete Jarman had damaged vertebrae in his neck and back after a 60-foot beech tree split in half and fell on him.
Like a lightning. It looks burnt, a tree.
His sternum was also broken, but remarkably, Pete escaped a fractured skull and brain damage. He is recovering slowly.
I always tell him to put his trainers on.
Paramedics were concerned that at 77 years old, Terry Jones might never fully recover from the serious injuries he sustained when he fell off a 12-foot ladder in his garden.
I was trying to adjust my TV aerial. My foot slipped, and I remember falling backwards and then nothing else until I awoke with my neighbour cradling my head. It turned out I'd fractured my pelvis, and I'd broken a number of ribs, so my chest hurt, and also I had double vision because I'd damaged a cranial nerve. I didn't realise it.
Terry spent 10 days in hospital before returning home to his worried wife and the start of a long recovery.
The consequence of it was I lost all muscle control in my left leg. It was just completely dead, and of course my rib cage was painful, but nothing could be done. It's just got to heal itself.
Terry is back to using a ladder, but only with help.
Just about right, yeah. You've got to be determined to get well again, and at some point you think you're going backwards, but you just press on and try and get back to square one. Pass me that mallet, lad. My wife isn't too happy with me going up ladders now. I'll go up a step ladder, but the extension ladder, yes, I have to be very careful about that one, I think, before I go up it again. Oops, yeah. I usually have a good sense of balance. I used to do rock climbing, but I think it's gone.
Terry is now fully recovered and grateful to the Air Ambulance team.
Where would we be without these sort of people? In my time of need, they were there, which is good.
Pilot Medic 1, Harry, we're going to fly sat up, mate.
Doctors found retired fireman Nigel Carrington wasn't suffering from a stroke. After further investigations, it appeared the symptoms were connected to 71-year-old Nigel's existing vascular dementia and Alzheimer's. He is now undergoing long-term treatment for those conditions.
The next find. Your next find? Just his shoulder. Yeah.
Scans in hospital confirmed veteran cyclist David Young broke his collarbone and damaged his ligaments when a ride out in the Dales went badly wrong.
It's a friend of mine, Michelle, and I was going for a nice long ride in the Dales up to Massam, which is about an 80-mile loop, and I hit a pothole, which was unfortunate on a quite a steep downhill section. I just remember the bars sort of slamming hard. Next thing I know, I'm rolling down the hill. That's all I can remember. They've actually removed a piece of bone from the shoulder because the two bones were clicking together, which was very uncomfortable, and they've put new ligaments in, which they call magic string. For a couple of weeks it was extremely sore, I've got to be honest, but it's settling down nicely now once the swelling's gone down a little bit. Come on, good boy. Go for a walk, mate. Are we going for a walk, eh?
David was helped in his recovery by his new puppy, Bertie.
Without Bertie, I'm not too sure. I think I would have gone stir crazy, to be quite honest. No cycling, nothing else to do. You can only watch so much daytime TV, so Bertie's been he's been a blessing. Bertie, come on, mate. Come on. Well, it hasn't deterred me from going back on the bike at all. Accidents happen, injuries happen. It could be doing anything, running, walking, anything. So, yeah, I'm quite positive in that respect. So, I'll be back on the bike at my first opportunity.